Hi, I'm Dr. Sharmeen, and I would like to share some insights into palliative care and how it's beneficial to patients with serious illnesses like cancer, and in what ways it can benefit the patient.
Hello viewers, myself Dr. Aman Yadav. I am a pain and palliative care physician at Denmark Group of Clinics. आज हम वर्ल्ड पैलिएटिव केयर डे के ओकेज़न पे पैलिएटिव केयर के बारे में बात करेंगे। देखिए, जो भी पेशेंट जिनको लाइफ थ्रेटनिंग डिजीज़ होती हैं या टर्मिनल इलनेसेस की हम बात करें जैसे कैंसर है, उनको हम बहुत बार बोलते हैं कि आपको पैलिएटिव केयर ट्रीटमेंट दे रहे हैं।
We have often heard of this term palliative care, and it evokes a certain sense of fear. It's a little bit scary word. People are not very comfortable with this kind of term that doctors often use. Mostly it is associated with an end-of-life care, and today I'm going to dispel certain myths and misconceptions in palliative care.
पैलिएटिव केयर जो है ये एक एमर्जिंग डिसिप्लिन है मेडिकल केयर का, जिसका मेन एम होता है कि हम पेशेंट के जो सिम्टम्स हैं उनको इस तरीके से मैनेज करें ताकि बेस्ट क्वालिटी ऑफ लाइफ मेंटेन रह सके पेशेंट की।
Palliative care is actually a defined medical specialty which is focused on helping patients as well as their families with serious illness to achieve the best possible quality of life. The goal of a palliative care is to alleviate the symptoms as well as manage the side effects that come with the treatment. The goal is also to reduce the stress, the anxiety and the depression that comes with the diagnosis.
पैलिएटिव केयर के कुछ प्रिंसिपल्स होते हैं, जिसमें सबसे पहला प्रिंसिपल होता है कि पेशेंट को और उनके केयर गिवर्स को हम ये प्रॉपरली एजुकेट करें कि लाइफ और डेथ दोनों ही एक इंटीग्रल पार्ट हैं, और हम जो ट्रीटमेंट कर रहे हैं उससे ना ही तो हम जो फैटल आउटकम है उसको प्रीपोन कर पा रहेंगे और ना ही उसको पोस्टपोन कर पाएंगे। हमारा जो मेन एम है वो है कि जितना भी लाइफ स्पैन हमारे पास बचा है उसको हम बेस्ट क्वालिटी ऑफ लाइफ मेंटेन करें। जो सिम्टम्स है पेशेंट को जितना मिटिगेट हम उनको जितना कम कर सकते हैं वो करें। साथ में सिर्फ फिजिकल सिम्टम्स ही नहीं, जैसे पेन है या और सिम्टम्स नहीं, हम इसमें पेशेंट के साथ साथ उनकी फैमिली मेम्बर्स को साइकोलॉजिकल और स्पिरिचुअल सपोर्ट भी देते हैं। और मेन टारगेट क्या है कि जो क्वालिटी ऑफ लाइफ है वो उनकी मेंटेन रहे, जितना भी हो सके वो इंडिपेंडेंट लाइफ स्पैन अपना पूरा कर सकें।
It is seen that palliative care started at the early stage of diagnosis. Soon after the diagnosis, when initially the treatments are being planned out, the palliative care assists in prolonging the life and survivorship of a patient. Therefore, it is helpful to start the palliative care process right or soon after the diagnosis. Instead of waiting for the disease to progress and bring about more symptoms, it's always good to start palliative care at the earliest. Palliative care is something that is given by our cancer care team. It involves more people than just the treating physician or the oncologist. So it has nutritionists, it has physiotherapists, it can have social workers. Basically, palliative care team looks at your emotional well-being, not just the physical aspect of disease, but also your emotional aspect of the disease, the psychological factors that you go through when you're diagnosed with a disease like cancer, and the spiritual aspect of the disease as well. Yeah, now you can talk to your doctor, you can ask them to give you the palliative care support. You can tell them that you want an extra layer of support for your cancer patient.
पैलिएटिव केयर को हमें एक इम्पोर्टेंट एस्पेक्ट समझ के उसके बारे में बात करनी चाहिए। उन्हें ये नहीं समझना चाहिए कि अब यहाँ से कोई होप नहीं है या अब हमारा लाइफ स्पैन शॉर्ट हो जाएगा इसकी वजह से। तो आपको पूरा ओपनली अपने डॉक्टर से इस बारे में बात करनी चाहिए, और इसको किसी तरीके का टैबू यूज़ नहीं सोचना चाहिए कि अब पैलिएटिव केयर की बात हो रही है तो अब कुछ नहीं हो सकता। तो ओपनली अपने डॉक्टर से इस बारे में बात करें, वो आपके पेशेंट को आपको बेटर चीज़ें ही प्रोवाइड करेंगे इसके लिए।
Sometimes people misunderstand the two and they are not having a clear understanding of what is palliative care.
होस्पाइस केयर थोड़ा सा डिफरेंट होता है। दोनों का ही पर्पस होता है कि पेशेंट को हमें कंफर्ट प्रोवाइड करना है, उनके सिम्टम्स को ख़त्म करना है। बट होस्पाइस यूजली तब शुरू होता है जब हमें ये पता चल जाए कि पेशेंट को ट्रीटमेंट से अब कोई आउटकम में फ़ायदा नहीं होगा, उसके बाद हम होस्पाइस के लिए रेफ़र करते हैं।
Hospice care is for patients who have a limited prognosis, who have a limited short span of life, and mostly it is an end of life care where the expected survival is 6 months or less. Communication is always the most important part of cancer treatment. If a patient doesn't feel that he or she can say whatever they want to say to their oncologist or the treating physician, then it increases the fear and anxiety of a patient, and it is detrimental to the outcome. Therefore, doctors need to be able to communicate with their patients better. It's always good to have a good patient communication process. Another problem in our country is that palliative care is not accessible to a large patient population, and therefore this is also a detriment and also a reason why we see increased mortality and less survivorship in our country. Cancer treatments are expensive, we know that, and then especially in our country, affordability is a major impediment. And cancer patients have to already go through a lot of expenses during the diagnosis, the treatment process, and of course the overall care and management of a patient. Therefore, to get palliative care is certainly a problematic area for a patient. Managing the finances is an issue for a large group of people, because palliative care is a care that comes at a certain cost. To have nurses at your home or in the hospital, to have additional people in your cancer care team, of course, comes with a cost. This is a major impediment why people don't go for palliative care, but it certainly has advantages if we add it at the earliest during the cancer treatment process. There is a misconception that palliative care is an end-of-life care. Palliative care is not an end-of-life care. It can be given right after the diagnosis, and it can continue for the entire treatment process. The idea is to give the patient a dignity, comfort, and reduction in symptoms. There have been numerous studies which show that palliative care is most effective when started earlier. So there was a study in a meta-analysis in 2018 and found that people with advanced cancer, they live longer and they enjoyed a better quality of life when they received the palliative care at the earliest.
सबसे पहली मिथ तो पेशेंट की यही रहती है कि पैलिएटिव केयर सिर्फ कैंसर के फील्ड में ही अप्लाई होती है। ऐसा कुछ नहीं है। जैसा मैंने कहा कि कैंसर के साथ जो और टर्मिनल इलनेसेस होती है उनमें भी पैलिएटिव केयर का यूज़ रहता है। बहुत से लोग सोचते हैं कि पैलिएटिव केयर जो है वो सिर्फ हॉस्पिटल बैकग्राउंड में ही प्रोवाइड की जा सकती है। ऐसा भी कुछ नहीं है। पेशेंट की फिजिकल स्टेटस को ध्यान में रखते हुए हम उनको होम सपोर्ट, होम पैलिएटिव केयर प्रोग्राम्स भी प्रोवाइड करते हैं।
Another misconception is that palliative care can only be given at a hospital setting, when this is not entirely true. Palliative care can be given even in a home setting where the patient is located. It can be given in a nursing home, in a clinic, or even in an outpatient clinic setting. Therefore, it doesn't have to be just a hospital setting. Palliative care also works at reducing the depression and anxiety that comes with a diagnosis. We know that cancer is a scary word, and a person diagnosed with cancer, he goes through a lot of emotions at that point of time. And of course, there is always this question of how much am I going to live, how much will I be benefited from the treatment, what is my course or journey going to be like once I'm diagnosed with the cancer. Another misconception is that patients who have a higher disease burden, only those people need palliative care. Now, this is a wrong conception. It is a myth. Patients who are having even low symptoms can also have palliative care. This will help with the survivorship. Whether or not the patient has a good chances of cure, and he may be cured also, and he may also live with certain limitations, but quality of life is an important aspect that needs to be managed through the entire cancer journey process.
तो ये जो सारी डिटेलिंग बातें हमने की, इसमें एक्टिव पार्टिसिपेशन पेशेंट का, उनकी फैमिली मेम्बर्स का ज़रूरी है, ताकि एक इंटीग्रेटेड अप्रोच करके हम उनको बेस्ट केयर प्रोवाइड कर सकें।
Therefore, palliative care is an important aspect of cancer treatment. It must not be ignored or neglected, and it's important to remove the myths and misconceptions in this process. Thank you so much.